Just how effective has the flu shot been this year? Well, it turns out it may be more effective than we first thought. The latest flu activity map from the CDC shows cases are just soaring right now, driven by a new variant, but new studies show the vaccine is actually working better than expected. Our chief health editor, Dr. Partha Nandi, joining us now. And what does the new data say to us?
Yes, Simon, so right now flu activity is very high. We're seeing people, more people coming in with cough, fever, sore throat than we've seen in nearly 30 years. But there's some encouraging news. Even though this year's flu shot isn't a perfect match, early studies show that the vaccine is still producing a strong antibody response, which is great. Now, the flu shot covers 3 strains this season: H1N1, H3N2, and 1B strain. The newer H3N2 strain, also called subclade K, wasn't included in the vaccine. Why? Because it emerged after production began. Researchers at Penn Centers for Excellence tested blood samples before vaccination and again about a month later, and here's what they found. Protection against the H3N2 strain jumped from 39% to 71% after the shot. For subclade K, antibodies increased from 11 to 39%. That tells us the flu shot does not have to be perfect to be helpful. It still trains your immune system to recognize the parts of the virus that don't change. So vaccination really still matters.
So is it effective for all ages? And then what about kids?
Yeah, important questions, right? So according to research, Simon, results were consistent across all adult participants who are between the ages of 24 and 81. Now, kids were not included in this research, but data from the United Kingdom showed that it used younger children in their studies, also showed that it was effective. Now, researchers looked at nearly 8,000 emergency room visits and hospitalizations and found that this season's flu shot reduced hospitalizations by about 70 to 75% in children aged 2 to 17. That's a big deal. It's especially important to talk about this since pediatric flu deaths were at record highs last season, totaling 289. And flu vaccination rates this year in kids are lower than we've seen in years. Fewer than half of kids have gotten their flu shot so far, about 42.5%. So if you haven't received the vaccination, haven't gotten vaccinated yet, there's still time. Flu season usually lasts into March. This season, the CDC estimates that more than 11 million illnesses, 120,000 hospitalizations, and 5,000 people will die. At this point, these numbers are already higher than they were at the same time last year. So getting vaccinated, to me, still matters, and research shows that it provides better protection against the H3N2 than going unvaccinated. So I think, people ask me all the time, didn't cover the strain. I said, no, it didn't cover the strain, but it still gives you enough protection to reduce hospitalization and reduce death.
Yeah, important context. Let's hope this message gets through.
Yeah, me too. Thank you.
Thank you so much, Doc.
Of course.
This week on the Dr. Nandi Show, Dr. Partha Nandi breaks down how bariatric surgery can be a powerful option for people who are struggling with obesity. You'll meet a guest who dieted her way up to 284 pounds and shares how surgery transformed her life and helped her with diabetes. A bariatric surgeon also joins the conversation to explain the different types of procedures and what patients should know about benefits and risks. Tune in on Sunday, January 11th at 12:30 p.m.